Rural and migrant health care. Healthcare availability is determined by geographical location, demographics, environment, economics, and social standing. In the U.S., healthcare can be divided into urban healthcare and rural healthcare. Whether from a heavily populated city or a small country town, healthcare options will differ. Rural healthcare. Rural healthcare can be defined as a population less than 2,500 people or less than 45 people per square mile. Subcategories of rural would be farm versus non-farm. About 1/5 of the U.S. population resides in a rural area. Urban. The definition of urban is relating to a city or of a city with a population of at least 50,000 people. Urbanization is man-made infrastructures and lifestyles. Rural medical care offers certain advantages, and so does urban. Rural medical care offers a more personalized approach to healthcare for patients. Because most rural communities are close-knit with small populations, doctors tend to get to know their patients, families, and their friends a little bit easier. Due to geographical location, lack of close resources like specialists and hospitals are available, so rural physicians benefit from the wide variety of knowledge they have to assist patients with conditions which would typically be treated by a specialist or a higher level of care in a bigger city. There is also lower healthcare cost for the patient and physician. Urban inherently has more access to different treatment options and specialists, job stability, and more options for employment for physicians and other medical professionals as well. There is a quicker turnaround time for recovery, and there is better healthcare access. The common disadvantages between rural and urban are rural communities inherently come with a smaller population as well as a smaller population of physicians per capita. Less resources for specialized care, fewer options for healthcare needs, there's fewer technological advances or availability to the technological advances. There is lack of preventative care, and rural residents tend to stay uninsured for longer periods of time due to higher percentage of self-employed people, small businesses which don't offer insurance, or agricultural enterprises. Urban careers as a whole have increasingly become more stagnant, increasing the unemployment rate and poverty. Specific urban factors that discourage people from being more active, like fear of crime in the outdoors area, poor air quality, the lack of community infrastructures like parks and recreational facilities and sidewalks, has been detrimental. Crowded living conditions in bigger cities correlate with a higher transmission of infectious diseases. Fast urbanization brings way to slums and subsequently poor hygiene conditions. Shared issues between urban and rural would be vaccination hesitation, as it is becoming more of a major issue amongst all facets of healthcare. A shortage of healthcare workers has urban and rural medical facilities scrambling to keep up with the incoming medical issues. According to a study done by the Johns Hopkins University, in 2030, it is estimated that there will be a deficit between 7,000 to 43,000 primary care doctors. Specialists will account for the shortage of 35,000 to 61,000 of those. The opioid epidemic in our country has reached far beyond rural and urban borders, to affect every facet of our population. According to the CDC, opioid overdoses accounted for more than 33,000 deaths in 2015 and 56,000 deaths in 2016. And the United States holds only 5% of the world's population but consumes over 80% of the world's opioids, according to NCBI. COVID-19 crisis has also affected the process of our healthcare system. We are unsure of the latent negative effects at this time, and no vaccine has been distributed. The lack of proper PPE and supplies for hospitals and smaller clinics has become a crisis as well. There are 4 levels of healthcare. There is the patient, the care team, the organization, and then the environment. The patient, of course, is the person of which is seeking services. The care team can be considered clinicians, nurses, therapy staff, and your family support system. The organization are hospitals, clinics, nursing homes. And the environment also plays a role, whether it is public or private. Insurers and research funders also have a say.
Healthcare access in rural communities. Residents should be able to conveniently and confidently access services such as primary care, dental care, behavioral health, emergency care, and public health services. Healthy People 2020 access to healthcare is important for overall physical, social, and mental health status, disease prevention, detection, diagnosis, and treatment of illness, quality of life, preventable death, and life expectancy. Rural residents must have the following to have good health care access: financial means to pay for services such as health or dental insurance that is accepted by the provider, means to reach and use services such as transportation to services that may be located at a distance, and the ability to take paid time off of work to use such services. Confidence in their ability to communicate with healthcare providers, particularly if the patient is not fluent in English or has poor health literacy. Trust that they can use services without compromising privacy, and belief that they will receive quality care. Health status and the healthcare access of farm and rural populations states that both farm and rural populations experience lower access to healthcare along the dimensions of affordability, proximity, and quality compared with their non-farm and urban counterparts. Disadvantages for rural residents result in higher morbidity and mortality rates compared to those of their urban counterparts. Rural residents use home remedies and local emergency rooms to manage their health care barriers. According to the 2014 RUPRI Health Panel Report, Access to the Rural Healthcare, a literature review and news synthesis, there are many barriers to healthcare for rural residents. These barriers to healthcare result in unmet healthcare needs: distance and transportation, health insurance coverage, poor health literacy, social stigma and privacy issues, workforce shortages. Travel. Some will forego treatment altogether instead of traveling. The remote or rural areas require people to travel for their care. Travel can be quite costly. The travel can be a burden on some, and rural people will substitute a primary care physician instead of traveling to a specialist. Health insurance coverage. Individuals without health insurance have less access to healthcare services. Health insurance affordability is a great concern to rural communities. Average insurance premiums are higher in rural areas than in urban areas, and rural counties usually have only one insurance issuer participating in the health insurance marketplace. Poor health literacy. This impacts the patient's ability to understand the information and instructions from their healthcare provider. Rural communities have a lower education level. There's a higher incidence of poverty in these areas. Fear and frustration can play a role in seeking healthcare, and lack of health literacy can make it complicated to navigate the healthcare system. Social stigma and privacy issues. Rural residents can have concerns about seeking care for mental health, substance abuse, sexual health, pregnancy, or even common chronic illnesses due to the unease or privacy concerns. Rural residents have fear or unease about seeking health care for issues that are not openly discussed, such as HIV. Workforce shortages. Healthcare workforce shortages directly impact healthcare access in rural communities. Having a regular source of care requires a regular healthcare workforce. According to ruralhealthinfo.org, a shortage of healthcare professionals in rural areas of the U.S. can limit access to healthcare by limiting the supply of available services. Rural communities contain about 20% of America's population. Less than 10% of physicians practice in these communities, according to Stanford Medicine. Fewer dentists also participate in practice in these areas. The majority of EMS first responders in rural communities are volunteer. We have a lot of geographic barriers that come into play. Distance, weather conditions, environmental barriers, climatic barriers, challenging roads, lack of transportation, lack of public transportation. Access to healthcare. Response times for the EMS increases in a rural area. Greater transportation times for ambulance transport. Rural agriculture and farmers. One of the most hazardous industries in the United States. According to the National Institute for Occupational Safety and Health, 417 farmers and agricultural workers died from a work-related injury in 2016, a rate of 21.4 deaths per 100,000 workers. Agricultural workers experience 100 non-fatal lost work time injuries each day. Transportation incidents were the leading cause of death, but many hazards exist on the farm. Health risks for farmers and farm workers include exposure to farm chemicals, pesticides, and fertilizers, as well as toxic gas, which may be produced from the common farm practices like manure decomposition and silo crop storage. Exposure to high levels of dust, which can contain mold, bacteria, and animal droppings, among other things. Falls from ladders, farm equipment, grain bins, and other heights. Exposure to ultraviolet rays from the sun, which can result in skin cancer. Joint and ligament injuries, which can result in arthritic conditions affecting mobility. Exposure to loud noises and sounds from machinery and equipment can result in hearing loss. Stress from environmental factors such as droughts, floods, wildfires, pests, and diseases affecting crops and livestock, as well as from working long hours, financial concerns, and feelings of isolation and frustration. Risk of suffocation in a grain bin if a person's engulfed by the grain. Risk of heat stroke, frostbite, and hypothermia from working outside in extreme weather conditions. Risk of injury from operating farm equipment and motorized vehicles. Risk of injury from working with livestock. And the risk of electrocution to persons operating large equipment that can contact overhead power lines. According to the 2014 study of farmers in eastern North Carolina, the top 3 farm-related stress factors were the weather, concern over the future farm, and outsiders not understanding the nature of farming. Stressors for farmers. Social stressors, not enough time for family, distance from doctors and hospitals, and limited social interaction opportunities. Financial stressors, market prices for crops and livestock, taxes, and healthcare costs. Stressors lead to anxiety, depression, feelings of loneliness, isolation, and farmers and agricultural workers suffer from high rates of suicide. Here's a list of additional resources to help farmers and agricultural workers find information and support regarding mental health and substance abuse. They include Farmtown Strong, Farm Crisis Center, and Farm AIDS Farmer Resources Network. Now we're going to move on to migratory and seasonal agricultural workers. Migratory and seasonal agricultural workers and their families face unique health challenges which result in significant health disparities. These challenges include hazardous work environments, poverty and insufficient support systems, inadequate or unsafe housing, inadequate healthcare access, lack of transportation, continuative care issues, lack of insurance, cultural and language barriers, fear of using healthcare due to immigration status, lack of transportation, and limited availability of clean water and septic systems. Migrant and seasonal agricultural workers face unique health issues like diabetes, malnutrition, infectious diseases, pesticide poisoning, and injuries from work-related machinery. The migratory culture of the group makes it difficult to develop a relationship with the healthcare provider. It makes it difficult to maintain a treatment regimen. It makes it difficult to track health records. Common healthcare concerns specific to migrant farm workers and their families. Heat-related illnesses. They spend many hours in sunlight, and this can produce heat-induced illness. Exposure to a variety of pesticides and toxic chemicals can cause serious health consequences. Injuries from mechanical or non-mechanical equipment and also hand tools. Bites from animals, insects, rodents, or snakes. Urinary tract infections from lack of toilet facilities available on the job. Higher susceptibility to infectious disease, tuberculosis from substandard living conditions combined with the barriers to accessing healthcare. Mental health issues influenced by cumulative effect of the constant relocation, poverty, and stress. Barriers that prevent rural migrant farm workers from receiving healthcare and healthcare coverage. Prohibitive costs of healthcare, the shortage of healthcare services, the lack of culturally and linguistically appropriate services, the lack of information about healthcare coverage options, confusing eligibility requirements, inability to get sick leave, concern of losing paid work time, social isolation and exclusion, and for undocumented workers, fear of how their immigration status will affect eligibility. Challenges of continuative care for diabetes, cancer, and HIV, coupled with inaccessibility to health care, this inhibits farm workers from seeking basic preventative care and standard annual checkups. Model programs or successful strategies to support health services focused on the rural migrant farm worker population include culturally sensitive health education and outreach, linguistically and literacy level appropriate materials, translation services, mobile medical units, transportation services, increasing collaboration with other agencies serving migrant populations, and portable medical records and case.
After going over what rural means versus urban and looking at the barriers and the different challenges that the rural community faces, I want to look at what is available near us. What is available in this area? The nearest county to us is Knox County, and I want to talk about how this is relevant to the rural community. Knox County is what is classified as a micropolitan community, meaning that there's more than 10,000 people but less than 50,000. A rural community, as we learned earlier, was under 2,500 people. But because it is less than 50,000, Knox County is still considered a rural county.
And the population in Knox County is 49,699, and in Galesburg it's 30,197. In Galesburg and then the surrounding areas, there are 71 primary care physicians. That offers quite a good opportunity to anyone rurally in the area. It gives them a good choice. Several of them accept low-income programs like Medicaid and things like that to help with the financial issues that come up in the rural setting. In the textbook, it talks about that the ratio of physicians in rural population size is 36 per 100,000 people, compared with nearly double that number in urban settings. So with that number in mind, we are well above that in Knox County, having 71 primary care physicians available. The other thing that's available is the Knox County Health Department. And they accept Medicaid, and they are available to uninsured individuals as well. So they accept self-pay as well. So anyone can come to the health department and receive dental care or primary care and different other like vaccinations and things like that. I want to talk about the Knox County Health Department for a minute because they offer programs that other places do not. They offer programs in family health, which include health education, health assessments, and they provide testing and screening for different diseases, chronic, acute, either one. They offer education on breastfeeding, family case management, WIC, genetics referrals, and others as well. They also offer programs in environmental health. They're trying to contribute to the prevention of communicable disease and protect the environment. So they offer education on food safety, potable water, West Nile virus, different environmental diseases, and that. They also offer programs in disease prevention. And they help to protect the community from diseases. They conduct disease investigations, they conduct surveys and monitor for disease, they educate the public in diseases, and they also promote, they also have programs in wellness promotion. So this helps keep us safe from diseases. They talk about things such as dental, lice, hand washing, hygiene, and even go into STDs, puberty, and that kind of thing too. Now, what if there is an emergency and somebody out in the country needs to get to the hospital as quick as possible? There are 2 hospitals available in Knox County. One is Cottage Hospital and one is St. Mary's. They both, from pretty much anywhere in Knox County, can be gotten to in less than 35 minutes by ambulance. So that's a pretty quick trip to the hospital, and it's an advantage to having the 2 hospitals that are there. From each city in the county, I looked up how long it actually takes from each city to get to the hospital in Galesburg. From Altona, it takes 18 minutes. From Victoria, it takes 21 minutes. From Mequon, it takes 24 minutes. From St. Augustine, it takes 26 minutes. From Williamsfield, it takes 28 minutes. And from Yates City, it takes 32 minutes. All of which you can see are under 35, which is an advantage for people who need to get there quickly. I want to talk about the capacity that each of the hospitals is able to carry as far as patients go. Cottage Hospital has 133 beds total and 12 ICU beds. St. Mary's, on the other hand, has only 81 beds total and 9 ICU beds. it seems like an adequate amount, but if you think about it as the population of the entire county, what if there was a pandemic? Well, we are in a pandemic. What if this pandemic was it got serious very quickly and we were unable to accommodate so many patients? I think that there are advantages and disadvantages to this number, in that in the rural community, it's great that we have these hospitals, but it's also a disadvantage if something bigger were to happen. Looking back over this whole presentation of rural and migrant workers, rural areas have definite barriers to healthcare, which is why knowing what is available is important in your area. Rural areas have a higher population of lower income individuals and families, so you can see why having an availability of healthcare for these individuals is important. Rural individuals tend to be less educated in healthcare and wellness, so can be afraid to seek healthcare because of unsubstantiated fears, which is why having these education programs available is so very important. Looking at Knox County specifically as a rural community, it has a lot available for rural and migrant workers. It has the educational aspect, it has the healthcare aspect, primary care, it accounts for low-income families, it accounts for older adults. The Knox County Health Department offers programs to educate in family health, environmental health, disease prevention, and wellness promotion. So there are many things available in Knox County that benefit the rural community. In conclusion, I came to the place where I realized that it is important to keep educated in what is needed and who is in the rural community, and that rural communities make up a large portion of the Illinois population, and so rural lives matter. They make up a huge proportion, and they need to be continually thought of. Thank you.